My name is Masresha Soressa. I am from Ethiopia and I am a public health specialist with a background of nursing and sociology. Currently, I am working for an organization called JSI. Previously, I used to work for an organization called Pathfinder, and much of my time was spent working for Pathfinder, specifically supporting and advising adolescent and youth reproductive health programs. For the last 10 years, I have been working with young people, specifically supporting these adolescent groups to obtain information, to access services, and also to transform their lives, positive change, and reach their visions. We know that Ethiopia is one of the most populous countries in Africa, and most of the adolescents, or the proportion of the adolescents, contribute like 13 million from the total population. The challenges that these adolescents face in this country include that most of the adolescents do not have access to obtain information, and also child marriage is very high, and also female genital mutilation is 47% of the adolescent girls face female genital mutilation. Sexual violence among adolescents 15 to 19 is high, proportional, and also most of the adolescents do not have access to obtain menstrual hygiene and management services in their schools. And because of the social norms and taboos, adolescent girls are forced to drop their schools because they don't have access to those menstrual services, and because of this, their lives will be disrupted and they fail to achieve their aspiration. Her Space program was designed initially from an experience that was taken from Rwanda. In Rwanda, there was a program called Safe Space targeting very young adolescent girls. So we took a lesson, an experience, and we adapted this safe space to Ethiopia's context. Her Space was a program that was designed to empower very young adolescent girls aged between 11 and 14. So the goal of this program, Her Space program, was to increase the collective and individual capabilities of very young adolescents in 3 regions. This program initially was designed only to empower adolescents. One thing that we have learned from Her Space that it didn't engage boys, and also this Her Space has missed to do or to implement some of the things to shift the underlying gender and social norms. It doesn't have any community engagement component. It missed to work with the surrounding service providing facilities like the schools, social protection institutions, and health institutions. We have learned that this Her Space program has missed to engage, to work with those 3 components. ActWizard has come up with a multi-sectoral and gender synchronized and also gender transformative approach, having all these components together and working with different various sectors. This was the milestones that we have gone through, add up some of the components from the space to ActWizard. The inception of ActWizard started that if we engage boys into the girls program, boys can have something to support adolescent girls, and also they can change themselves. The 3-pronged strategy that ActWizard has followed were, the first one is increasing the individual and collective capabilities of those adolescent boys and girls, which means to increase their awareness, their knowledge in the areas of various issues like health, education, and so on. And the second strategy was shifting the underlying social and negative gender norms and we have been addressing those norms by designing different activities. And the third one is supporting the surrounding service providing facilities like schools, social protection institutions, and health institutions. So these are the three-pronged strategies that ActWizard has followed. One of the interventions that we designed to alleviate this problem, the menstruation problem, the menstrual challenge, was supporting or establishing menstrual hygiene management corners in schools. We have started to work with schools, and almost all schools did not have those corners for adolescent girls when they get menstruate. We trained adolescent girl school coordinators like teachers and some other staffs. We provided them skills training on how to prepare local pads. And then when they get back to school, they will just prepare those local pads and materials so that when a girl gets menstruation during her school, she can simply go to that corner and get counseling from a school counselor, and also she can change menstrual pad and she can get dressed and go back to her class. This was the design, and it has impacted problems of many rural adolescents. This is one of the high impact intervention that we have achieved during ActWizard implementation. One of the challenges that we faced during implementation of ActWizard was parents were not convinced, parents skeptic about the program, because very young adolescents and older adolescents in rural areas are expected to support their parents. So when we take them for a discussion, they were skeptic, and some of the sessions focus on SRH issues. It was against their social and religious values, so parents were skeptical or suspicious of the program. So we addressed gradually by designing parents engagement program. So we have resolved the parents challenge by just engaging them into different sessions. The second challenge that we faced was from the religious institutions. There was a religious backlash at the start of this project because some of the sessions directly mentioned some SRH issues. Some of the pictures were intimidating for these religious scholars. So they were challenging us that this has come to their community just to change their religion. So to resolve again this problem, we have worked with different stakeholders, religious institutions like the different offices or synods from to lower. So we engaged all the respected scholars from top to bottom to just get convinced the purpose of this project. And the third probably will be the COVID. So COVID has challenged us a lot, and we have overcome this by designing some innovative interventions, working closely with communities. The bigger impact of establishing menstrual hygiene and management specifically, and the whole ActWizard in general, is it just supported them to focus on their aspirations. And also some of the community problems. The environment was not healthy, like girls used to be raped on the road on their way to schools. And since we have engaged the community working on SGBV, the community has become protective of these girls. So SGBV has reduced, the rates of child marriage has also reduced, and school absenteeism has dropped drastically, and adolescents started to attend their schools and focus on their health and their aspirations. When we just visit those girls and adolescents, they are very much transparent, and their voices are increased and are courageous. So all in all, the positive impact ActWizard has laid on these adolescents is very much immense. ActWizard impacted my life in a way that I have been getting an energy every day when I work for ActWizard project. When we go to the field and see those adolescent girls with some changes. When we visit, they were fearful. They are not interested to talk to a visitor or a guest. But we have seen adolescent girls transformed. Working with adolescents is like working with someone who gives you energy every day.